Depression is a mood disorder which may occur in all age groups, although the symptoms may differ in children. It is a relatively common condition and has a tendency to recur. Some affected persons may turn out to have bipolar disorder, in which case episodes of mania occur. Clinically significant depression, also called major depression, is twice as common in women as in men, and many affected individuals seek help from spiritual and traditional healers. For a good proportion of those who go to the hospitals, their condition is not recognized. Depression is a significant cause of morbidity all over the world, and most people who attempt or successfully complete suicide have depression. One should not miss or take for granted statements made by patients such as "I want to die," "life is not worth living," or "I'm fed up with life." All cases of attempted suicide should be referred to a psychiatrist after initial management of the presenting complication. Example: self-inflicted injuries or poisoning. Recurrent depression or unipolar depression is treated differently with antidepressants from bipolar depression, which responds more to mood stabilizers. The diagnostic criteria for major depression relies on the presence of at least 5 of the symptoms. I'll list experienced every day for at least 2 weeks. In the treatment of depression, maximum tolerable doses of antidepressant medications must be given for at least 6 weeks before deciding on a particular medication, as if the medication is not effective. So after an episode of depression, treatment must be continued for at least 6 months. And as there is a high risk of relapse within this period, and antidepressants must be stopped immediately if a manic swing occurs. Patients with suicidal tendencies must be admitted and kept under close observation. So the causes are could be genetic, familial, environmental, psychosocial factors, and endocrine disorders like hypothyroidism and Cushing's syndrome. Symptoms include depressed mood, often reported as feeling out of sorts, loss of interest or lack of pleasure in things previously of interest, significant weight loss or weight gain, insomnia or sleeping too much, psychomotor agitation or retardation, fatigue or loss of energy, feelings of worthlessness or excessive guilt, impaired thinking, like poor concentration, indecisiveness, worrying excessively, and multiple bodily complaints, suicidal ideas or thoughts of death, hallucinations or delusions of morbid themes in severe cases. So in children, truancy or refusal to go to school, poor school performance, bedwetting in a previously dry child, odd behavior, aggression or defiance, irritability, appetite changes, and some of the adult symptoms I listed. So the signs that are usually elicited are depressed mood, evidence of weight loss or weight gain, agitation or retardation, and hallucinations. Investigations are FBC, BUE, creatinine, FBS, thyroid function, and cortisol levels if indicated. You administer a standardized scale of depression, such as the PHQ, that's a patient health questionnaire 9-item scale. The main treatment objectives are to reduce the symptoms, to prevent disruption to normal life at home, work, or school, and to prevent suicide. non-pharmacological treatments, counseling, psychotherapy, specifically cognitive behavior therapy, and electroconvulsive therapy. Pharmacological treatment. The first line treatment we give fluoxetine oral in adults 20 milligrams once daily for 2 to 4 weeks. Then you increase if necessary to maximum dosage of 80 milligrams, and in children 8 to 18 years to give 10 milligrams once daily for 1 to 2 weeks, and then you increase if necessary to a maximum dosage of 20 milligrams once daily. Less than 8 years is not recommended. Use with caution in children with epilepsy and stop if seizures occurs. Or you can give sertraline oral in adults 50 milligrams once daily, and then increase if necessary by increments of 50 milligrams at intervals of at least 1 week to a maximum dosage of 200 milligrams daily. In children 13 to 18 years, give 50 milligrams once daily. Then increase if necessary by increments of 50 milligrams at intervals of at least 1 week to a maximum dosage of 200 milligrams daily. And from 6 to 12 years, we give 250 milligrams daily. Then increase if necessary to 50 milligrams daily after week 1, and further increase if necessary in steps of 50 milligrams at intervals of at least 1 week to a maximum of 200 milligrams daily. Less than 6 years is not recommended. Or you can give citalopram. So citalopram oral in adults, you give 20 milligrams daily, once daily, and then increase if necessary in steps of 20 milligrams daily at intervals of 3 to 4 weeks. The maximum dosage of 40 milligrams. In children more than 12 years, you give 10 milligrams once daily, and then increase if necessary to 20 milligrams once daily in the evening over 2 to 4 weeks with a maximum dosage of 40 milligrams once daily. Less than 12 years is not recommended. Or you can give imipramine oral in adults 25 to 50 milligrams once daily, early evening, and then increase by 25 milligrams every 3 to 5 days up to maximum of 150 milligrams. In children is not recommended. You could also give amitriptyline oral in adults 25 to 50 milligrams once daily as early evening, and then you increase by 25 milligrams every 3 to 5 days up to a maximum of 150 milligrams. In children more than 16 years, we give 5 to 15 milligrams 12 hourly. Less than 16 years is not recommended. The management of patients with depression requiring night sedation, we give lorazepam oral in adults 2 to 3 milligrams 8 to 12 hourly with a maximum dosage of 10 milligrams daily. In children 2 to 18 years, we give 0.05 milligrams per kilogram 8 hourly with a maximum of 2 milligrams daily. Or you can give diazepam oral in adults 5 to 10 milligrams 6 to 12 hourly. In children 12 to 18 years, we give 10 milligrams 12 hourly, and 5 to 12 years, we give 5 milligrams 12 hourly. So referral criteria. So refer patients with atypical or unusual symptoms, hysterical or phobic features, and those who do not respond to adequate antidepressant treatment within 2 months to a psychiatrist, or as should children suspected to suffer from depression. So the patients requiring cognitive behavioral therapy should be referred to a psychologist.